Good afternoon, everyone, and welcome to this very special event, Translating Science into Care. My name is Sue Hunt, and it's my great privilege to be the Chief Executive Officer of the Royal Children's Hospital Foundation. Can I begin by acknowledging the traditional owners of the land on which we gather today? For us here at the hospital, it's the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and emerging, and any Aboriginal people who are with us today. I'd also like to welcome our presenters, both on my left, Professor Sarath Ranganathan, the Stevenson Chair and Head of the Department of Paediatrics at the University of Melbourne, respiratory physician here at the RCH and Head of Respiratory Diseases Research Group at the Mundoch Children's Research Institute. Welcome, Sarah. Thank you so much for coming. And also Jim Carroll, Trustee of the Donald Ratcliffe and Phyllis McLeod Trust, who's currently supporting the RCH Director of Nursing Research, position of which is held by Professor Fiona Newell here at the hospital. We're grateful that both of you could join us today. Ladies and gentlemen, a bit of housekeeping. There are captions, live captioning available for today's event, which you can view by clicking on the live transcript button in the menu bar below. These captions are automatically generated, so they may not be perfect, but we do hope they'll be helpful to some of you who need them. So this is an interactive session and we would love to hear from you this afternoon. So please use the chat function to tell us your name and where you're from. So you're going to have the opportunity to ask questions just a little later on. I just wanted to kick off today by just, expressing how fortunate the hospital is to have such incredible support from our community. And we're delighted to be able to bring you this event. We're endlessly inspired by the long-term support that you and others in the community give our great hospital, and this gathering is just one way that we can express our gratitude and our sincere thanks. As you may know, we're celebrating 150 years of great care here at the hospital this year. From opening its doors with just 6 beds in 1870, the RCH has grown into one of the world's leading academic health science centres. And this is largely due to philanthropy and the support of people like you. Today, much of the work that's taking place right across our campus is only made possible by philanthropy. All of the donations that we receive through the RCH Foundation support 4 key areas: innovative patient and family-centred care, groundbreaking research, and we're going to hear a lot about that today, the latest equipment and technology, and leadership, education and training of our teams right across the career course. Today we're here to particularly focus on research and how the latest initiatives being supported by philanthropy are enabling a brighter future for our children. We'll also turn our minds to the future as we hear about several upcoming research grants. At the RCH, right across the Melbourne Children's Campus, we've nurtured a very strong research culture for a great length of time of that history of the hospital. I'm sure you'll all agree that during this COVID-19 pandemic, we've developed an even greater appreciation of medical research and the life-changing role it can have. We're seeing remarkable outcomes from research taking place right here as our clinicians quickly take the latest findings from the bench to the bedside, and that enhances patient care right here and right now. Philanthropy and support from people like you is the major reason that this can happen. So, enough from me. To learn how research is taking place on campus, how it's evolved over time, and our vision for the future, I'd love to invite Professor Ranganathan to talk to us a little bit more. Sarah, thank you very much.
Thank you very much, Sue. It's a great privilege to talk about something that I'm very passionate about, because I do believe that the Royal Children's Hospital is really an exemplary research hospital. And you might expect me to say that because I've been at the institution for about 17 years, but I'd like to say that my impression of this hospital goes way beyond that, even to when I worked in the UK as an intensive care physician. I recall in my working day tying in tubes, life-saving endotracheal tubes, using what was called the Melbourne tape technique, using a reference book for all the drugs that were used on the intensive care that emanated from this institution. So at one point I knew way more about this hospital than I knew about Australia or Melbourne itself. But the reasons for the hospital having this success are the fact that it has a very strong and protracted visionary approach to research. So I'd like you to just have a look and join me in appreciation of some of the developments that have occurred over a long period of time that make the Royal Children's Hospital a great research institution. For example, just after the war in 1948, Australia's very first paediatric clinical research unit became operational. And I find it amazing that at that period, in a very difficult time, that people here were thinking at that stage about how to enhance clinical care through research. The other strength of this hospital is the partnership with the foundation, as Sue has mentioned, but also the research institutes and the university. And in 1951, the university passed regulations allowing students to carry out research for postgraduate degrees, such as PhDs, at the Children's Hospital. And remarkably, we have about 150 people currently on the campus undertaking research for various forms of higher degrees. In the 1960s, the Royal Children's Hospital Research Foundation was established. And initially that encompassed three major research groups, which were a clinical research unit, which was headed by Howard Williams, a gastroenterology unit headed by Charlotte Anderson, and surgery headed by Doug Stevens. And subsequently there was also a hematology unit attached. And one of those, the gastroenterology unit, led to one of the greatest discoveries, which I'll talk about in a minute. And of course in 1986, the Mundoch Children's Research Institute began when Professor David Danks established the original institute through, again, unparalleled generosity and support via philanthropy through Dame Elizabeth Mundoch. So I wanted to highlight probably, I think, one of the greatest research impacts that the hospital has been responsible for. And this is not my opinion, this is actually the opinion of Melinda Gates, who alongside Bill Gates is probably one of the world's greatest philanthropists. I understand has donated and overseen the administration of about $35 billion of support for research around the world. Melinda Gates cites one of our researchers, that is Professor Ruth Bishop, as being the greatest influence on her philanthropic career. So Professor Bishop, who was AO at the time of this article, now AC, and subsequently the first woman to win the Florey Medal in Australia, was a researcher in that gastroenterology research unit. And in 1973, when studying the causes of infections of the gut or gastroenteritis in children, identified the viral cause of that, rotavirus. This has been an incredibly impactful bit of research. At that time, and shortly afterwards in Australia, we would have seen about 10,000 children each year who were hospitalised with gastroenteritis. And around the world, about 500,000 children dying from this condition. And that work led to the development of a vaccine, which really decreased the terrible mortality associated with this condition. And now in Australia, we only see around 2,000 children being admitted. And it's also had a legacy by way of other clinicians who've taken up this research, particularly Graham Barnes at the time, and more recently, Julie Bynes. And they have developed a further vaccine, RV3. This is a strain of this particular virus that's safe to give to babies. And that's really important because if you're going to use this vaccine worldwide, sometimes it's at birth that there's the only contact between mothers and babies and healthcare physicians. So to have a vaccine that's safe and effective that you could give at birth means that there are many more lives around the world that are going to be saved through this particular vaccination. Now, some would say that this important discovery on our campuses is important as the great discoveries that led to vaccinations against polio, for example. And I think it's worth celebrating and all of us remembering this great legacy for our institution. So I want to come on to talk about what we hope will be further human legacies and people that provide great further impact in terms of research. And this is really important because it's been shown that most research doesn't actually lead to improvement in patient care. And one of the things that's recognised to try and improve that is to increase the number of clinicians, so that's nurses, allied health practitioners, and also medical practitioners, engaging in research to try and improve patient care. And one of the things that we've done on this campus, thanks to the generosity and foresight of the foundation, is actually invest in people that we hope could rapidly improve patient care. And these are our clinician scientist fellows. There's also other investment in the director of allied health research and also nursing research. So these 32 individuals here, every one of them has got a very important research story to tell. And I wish I could talk about all their research stories and the great impact that they're providing. But I'm just going to concentrate on three. The first I'll mention is Professor David Tingay, and he works on the neonatal intensive care. And the children who are extremely sick and born prematurely on this unit, you can imagine, there'd be a lot of reluctance about getting these children out onto their parents' laps. And there was a fear that that would actually be quite detrimental to their life support. But David Tingay and others have shown that actually that babies benefit from that care by being held by their parents. It's called cocoon care. And he actually showed through his research that their breathing actually improves in that situation. So this is a practice that's now adopted worldwide. The next is Layla Ibrahim, who, like myself, was attracted by the history of the hospital and came here to practice research as well. And she studied a condition called cellulitis, which is a skin infection. And traditionally, this is treated with intravenous antibiotics that are delivered in a hospital. And what Layla showed was actually it's perfectly safe and, in fact, much preferred by families to deliver those antibiotics in the individual's own home. And you can imagine most children would rather have this treatment in their own home than to be dragged into hospital. And again, this is a practice that's now being taken up worldwide. And the final person I'd like to mention today is Dr. Shiv Shantikumar, who has recently finished his PhD, but currently is working on a completely new concept of how we might look after people who have chronic diseases. And traditionally, these people are dragged up to the hospital to be managed in outpatients. But what Shiv is looking at are new mechanisms to monitor people within their own home so that we can manage them as physicians within that setting rather than in hospital. So a whole new approach called virtual health. And we're looking to see this completely change healthcare for the future. And this, again, is something that we'll be leading from this particular campus. So these are individuals that we've invested in. And when I say invested in, they've published over 400 research publications between them, and they've brought in $20 million of external funding. So the philanthropic money that's invested has really been used to leverage greater outcomes. What we'd like to do next is to encourage enhanced research culture throughout our campus, and the university and the Mundoch Children's Research Institute are partnering the foundation and the hospital in trying to upskill all our clinicians so that they will be much more impactful and improve care through knowledge and research pathways. And so we're developing what we're calling the research incubator to support people better, to connect people better, and to train them in research skills and methods to try and bridge that gap so that more of that 85% of research that currently is not impactful can be used to drive and improve care for our patients. So there are a number of reasons to do this. Importantly, any money that's invested in research, we want to make sure that that money is leveraged and used to be the most impactful it could possibly be. So I've listed here the reasons that we want to do this. We're attempting to enhance the research culture on our campus, and this will be world leading, to provide pathways for those who want to engage in research, to upskill, to extend the opportunities to develop research skills beyond doctors and surgeons into the allied health and nursing researchers, to share knowledge and break down silos. And we're hoping that these clinicians can be the vanguards of transformative change for the future. So we change completely that approach to integrating research and clinical medicine. And finally, I wanted to mention about another visionary development which the Foundation has funded in 2019, and this is the establishment of the Centre for Health Analytics. What we want to do here is to use all the tools and information systems that create data that will enable us to improve the care we provide. So these could be simple decision support mechanisms. So if a child were to present to the emergency department with certain types of abdominal pain, there might be an indication to that clinician provided through our electronic medical records that they should instigate certain investigations, for example, an ultrasound. It might be that we enhance research on campus by embedding people who come into the campus into clinical trials so that we're much more able to improve their care directly. So this is, again, a leading program of research that we could not do without the benefits of philanthropy. So these are some of the ingredients then to summarise for the success story of research at RCH. There's a long-standing foundation and a platform built on a visionary approach, partnerships with our academic institutions such as the university and our research institutions, the continuing legacy built upon the great people that have come before us, investment in the people that are going to do this work, but critically, and I think this is the most important thing, has been the visionary and the partnership with philanthropy. And with that, I thank you again. And I would like to say that our future looks very bright in terms of research. And the legacy is that any philanthropic money that's invested, I think, will be used to the benefit of patients, perhaps in a way leading other institutions worldwide. So with that, thank you, Sue.
Thank you, Sareth. Very thought-provoking presentation. I was just reflecting on the three examples that you gave about from the clinician scientists as an incredible example of how where research funding from philanthropy can actually affect immediately. So the Cocoon project of David's, Layla's hospital in the home work, so the work that's actually happening there for vaccination in the home, and Shiv's work, the third one, in virtual care, we're actually supporting with additional funds in each of those projects as well. So I think sometimes we think research can just be out in the future, but of course one of the most important things that we can do is translate care right now, and I think they're great examples of how, and it's funny that you should pick those three that are actually where we're then funding the programs that have come out of the research. So really fantastic. Thank you so much. Folks, you're going to have the opportunity to ask questions fairly soon, so think them up now, maybe shoot them through so that we can have them there ready to go. But before we do that, one of the things we really wanted to do today was, as well as hear from one of our leading researchers on campus, was also hear from one of our long-time friends and supporters who are actually making a difference and making that philanthropy happen. I introduced Jim Carroll before. Jim, thank you so much for joining us. The Donald Ratcliffe and Phyllis McLeod Trust is, as I said, supporting Professor Fiona Newell's position, and that's a named position for the Trust, and that nursing research is such an incredibly important part of the campus as well. And sometimes under-supported one. So we're really thrilled that the Trust has, seen its way clear to join us on that journey. But I wanted to ask you, Jim, first, if you can share with us your relationship with philanthropy, how that began, and what are the motivating factors that inspired you and, in fact, inspired Donald and Phyllis.
Thanks very much, Sue. It's a pleasure to be here. Yes, Don and Phil were my uncle and auntie, and they left a legacy and appointed me to the position of trustee of a perpetual charitable trust that they created. That involves me in management of the investment portfolio, also involves me in allocating the revenue that I can generate from the portfolio for research purposes, and also labours me with the job of trying to find a successor one day. The mandate is for donations to be made for medical research within Victorian institutions. And latterly, my key focus has been on the Children's Hospital for a variety of reasons. Don and Phil were not lucky enough to have children, but they had a number of nephews and nieces, of which I was one, and they were very fond of young children. I myself have 6 of my own children and 14 grandchildren, and so a core purpose in my life is about the welfare and happiness of children, not only within my own family but at large. And I also believe that that's probably a core purpose that could be translated to the Children's Hospital: welfare and happiness of children. Unfortunately for Sue, I've said it to her many, many times, it's not children that should be sick. It's old broken down people like myself that should incur illnesses. I heard for the first time from Sarah's presentation the term cocoon project, and I can so relate to that word cocoon, in particular in relation to the work that Professor Fiona Newell heads up, which is in nursing research. Nursing is absolutely at the forefront of the care of the young people that have to present at this hospital, and the aspiration for Fiona's team is not just care but great care, and it inspires me the way she oversees so many young nursing professionals embark upon a variety of research projects and to participate very indirectly, but to hear about the initiatives that they follow through in helping the young children. So far, the Trust has donated by the end of this financial year, will have donated in excess of $2.1 million to the Children's Hospital, and it's a great shame that my uncle and aunt are not here to be aware of that. They'd be very proud of it, and as the means by which that can take place, it's a great honour and a privilege for me to be involved with the hospital, Sue. One of the other programs that the Trust is currently funding is one of Sarah's scientific research people, Professor Penelope Bryant, and she is undertaking research in relation to febrile urinary tract infection and the treatment with antibiotics that might take place at the home rather than the hospital. And again, who's at home? Mum and Dad. And that connects to this cocoon concept of a child being treated but in and around their family environment. So Penelope's work, Fiona's work, just absolutely wonderful, and it's a great privilege to be involved. So,
thank you so much. Don and Phil, they must have, when they thought about medical research themselves, they must have had an inkling or a reason behind that. What was when they've been planning, what to do with their legacy? What would have gone through their minds?
Well, I think they were very community-minded. Don was a fairly high-ranking officer in the Royal Australian Air Force. Very proud of the fact that he had a couple of audiences with the Queen, which we heard about ad nauseum.
Wow!
But it was a combination, I think, of just their community civic-mindedness as well as their fondness for children, albeit that it's been me that's made that end decision, but very, very community-oriented people, and I feel as though they just, when they passed on, wanted to leave something behind that would make a contribution to our community in making it a better place to live.
Yeah, and I guess I can only imagine as well, having thought that through about keeping the estate together and the trustee, in your case, delivering on the income that you can generate. I mean, that's an incredibly that's huge foresight, really, because it's saying we want to be perpetual. We want to have impact, well into the future, and that's something that you can do when you're making the decision to leave a legacy, isn't it?
Yes. Yeah. Sue, you'll be a better placed to talk about this than I would, but there's a number of ways that you could structure the legacy that you want to leave, and rather than simply dissipate, that's a terrible choice of words, but rather than just simply allocate the capital in one or two areas, this way their legacy will continue forever. And so it's a great tribute to them.
Yeah.
And it's a very humbling experience for me to have been chosen to try and see their wishes through. So
yeah, thanks, Jim. And I'm somewhat self-serving question in a way, but what would you say to anyone who's thinking about supporting research here at the hospital?
Well, I'm a little bit biased because I've been lucky enough to be involved with this place for a while now, but there's a gentleman in the room with us today, Sarath, who's just given a presentation, and I hung off every word that he said and was genuinely excited about the stories that he was able to relate about the research. I mean, if you just pause for a moment in this terribly chaotic world that we live in and just think through some of the things that Sarath has been able to share with us today, it's just the skill of these people, their dedication, their commitment, and the end result that they provide to our community is just awesome, in my opinion, Sue.
Thanks, Jim. Thank you. Donald and Phyllis's story, I'm sure you'll all agree, folks, is truly inspirational. And Jim, we're just really grateful to you as trustee for your ongoing support. You and I both know just how important that is to us here, and we're really honoured to be able to put the McLeod-Ratcliffe name on our Director of Nursing Research, just to show how incredible that legacy is. So thank you so much.
Absolute privilege, Sue.
Yeah, thank you. So, ladies and gentlemen, your opportunity to send some questions in. So please type them in using the chat function, and we'd love to hear from you. But I'm going to kick us off. Sarath, we often talk about the fact that we're an integrated academic health science centre here. As someone who works across all three of those areas, the hospital, the Mundoch Children's Research Institute, the University of Melbourne Department of Paediatrics, what do you find is most unique and beneficial about the approach that we take?
I think one of the unique things is the way that we come together as partners and actually strategically look at the future. And we're doing that from an academic institution like the university, so we're incorporating ideas around education, and that certainly adds value to the work of the clinicians. The clinicians are the best place, as Jim had said, the nurses are best placed to look at what's the way to improve care. And we're providing the skills for those individuals to do it. And alongside with the research institutes, there's professional researchers, there's laboratories, there's basic scientists, so we can all come together. The important thing is that vision, the shared vision of trying to improve care. But like what Jim's describing there, I think we're sort of realising that to a certain extent. So I find it a privilege to work across those three institutions and to have the link into the foundation. And I just want to come back to something that Jim mentioned there about legacy, because I think there's also a legacy in the research impact. Each one of those, it's not a finite project that improves care. It leads to so many other questions and so many other improvements that initial investment really, we call it seed funding. And that the plant or the flower that gives birth to it leaves ongoing legacies. So every bit of philanthropic donation that's come in, certainly in my experience, in my research in respiratory, is leading to the work that we've done now, even if that donation was 20 years ago.
Yeah, no, very true, isn't it? What do you find most rewarding about your role? It could be any one of those three roles, I think, but what's sort of most rewarding for you?
Well, I'm a clinician, so there's obviously reward in trying to improve the health directly of patients through your knowledge and your training. My current role really is about bringing people together. So when people come with questions and problems that they have in terms of trying to improve care, it's dragging people into the room and adding value by getting people and their skills that we wouldn't normally put together to work together to try and find the solutions. I find that very satisfying. The other thing is really supporting the brilliant people. I think you sort of get on your career and you realise you weren't that brilliant yourself, but you can recognise it in others. You think, well, I think they need a better go than me. So actually encouraging those and supporting their research. And finally, the other crucial thing is we don't do this research now divorced from the values and opinions of the consumers. So most of the research, we're partnering with families to say, we think this is important. What do you think is important? And actually designing that research together. So these are things that are done in the modern world that weren't necessarily done 30, 40 years ago. There is a change to the culture of research. So I find those improvements to be very exciting. Yeah. I mentioned the 150 or so PhDs that we have on our campus. When I did my PhD in London at that point, there were apparently only 8 paediatricians that had PhDs or higher degrees in the whole of the UK. Wow. So that's how effective and impactful we are on this campus.
Yeah. No, it's true, isn't it? I guess, we did an international review of the campus a few years ago, as you recall, and it was interesting that for me, as a non-medical person, one of the things that came out of that was that if you want to be a research-intensive hospital, the very first thing you need to do is to inquire and ask the questions every day. So come into work, no matter what your role is, and think about, how do I improve today, whether it's clinical practice, whatever that is. I mean, that's kind of really interesting, isn't it? Is that just to, you might think of research as being something huge, but in fact it's just how do you, in first instance, how do you improve every day?
Yeah, I'd say research is a skill. It's having the tools to be able to affect that quality improvement as you describe, and our job's never done, so we're never happy with the care that we provide because it's always going to improve. And there are new technologies such as informatics and data and our electronic medical records, and that's really what we're trying to harness, for example, with the Centre for Health Analytics. But we have to rely on the support from the foundation and other philanthropy to really kickstart these visionary developments.
Thanks. So I've got a question from the group. So from Stuart. Hi, Stuart. Presumably all research organisations want to increase the effectiveness of their research. So what's the RCH doing differently to increase that 15% number, Sarah, that you quoted earlier, to be ahead of other organisations?
Yeah, I mean, that's a great question, Stuart, and a really important one. And in fact, I've just this morning had a conversation with the head of the Melbourne Academic Centre for Health, whose job is to actually try and narrow that gap. And his conversations with me were important because they highlighted that, in his opinion, we're ahead of the curve. We've invested in some of the younger researchers already. We're bringing together some of the skill sets and institutions in a way that's not necessarily done in other institutions. And this concept of the incubator to enhance the abilities of all the clinicians on the campus, the nurses, the allied health people, the surgeons, the physicians, to say, you want to improve your care? Here are the tools to do it. Talk to these people, they've done it. Share the resources, share the skills. That actually, surprisingly, is not done in any other hospital in the world at the moment.
Yeah, really.
And in fact, around the world, the number of clinician scientists has been at risk. And we've actually preemptively reversed that trend, and I think we're in a great position to make sure that we stay ahead of the pack, if that's a good answer to that question.
Yeah, it's a great question too. Thanks, Stuart. I guess that's you talk about the clinician scientists again. It makes me think of another thing that I was really very much aware of when we sat down and talked. Had a group dinner with people. Was another part of research is, just being able to have that group of people together to be able to, in all sorts of different ways, be able to just talk together about what innovation looks like, and to build a network and a rapport across campus as well, because it can be very isolating, can't it? Or it can be something which is a practice across groups of people. And you're part of that, clinician scientist group. Tell me a little bit about how just important that being able to come together, that having that network, having a collegiality of 32 people has been.
Well, as you say, it's critical to have that communication. It's critical to have that network. Whenever two researchers meet and talk about their areas, there's always some new idea that comes from it. So unless you're having that community, you don't generate new ideas. And it's very important that someone who, like myself, is a respiratory physician, can have conversations with people who might be experts in stem cell research and say, well, we see this problem here where we wondered if stem cells would be the answer for a cure in the future. You have to get these people in the room. And that's one thing I think our campus does really well. And the Clinician Scientists Fellowships, which the Foundation's funded, has led to a sort of community and leadership around this. And our hope is that we'll embed that leadership into all clinical departments in the hospital. So there is that skill set and expertise that can say, that department in gastroenterology did something like this. Let's get them here and advise us on how to do it. At the moment, we tend to work a little bit in silos because we've been very busy. But there's great ways to work in the future through that network.
Yeah, great. Thanks. Jim, have you got reflections on that?
Yes, Sue. I think it's probably appropriate that I should give the Director of Nursing Research another plug, given that the Trust is funding Fiona. But next Wednesday, for example, International Nurses Day, when else would you have it? Fiona is convening an annual symposium that she organises. And I've been lucky enough to be a guest at those symposiums in the past. And at that symposium, presentations are made by younger members of the nursing staff who are overseen or supervised by Fiona. And I can relate exactly to what Sarath has just said, in that during that symposium, there's an exchange of information amongst highly skilled and capable and caring people that just energises the whole theatre. And while the day is ongoing, there's an absolute buzz within that theatre of all the ideas that have been generated. And I won't do Sarath's presentation justice, but from that exchange, new things just grow, one of my life mottos has always been yearn to learn, and in that theatre presentation there's so much learning going on. It's exciting.
Yeah. Jim, when you got involved with nursing research in particular, did it surprise you, or did you have that sense already about just how not how close nurses are to the bedside, we know that, but did it surprise you to sort of learn that there's a great proportion of nurses are thinking, to look at research so that they can make change quickly?
Yes, it did. Surprising and then exciting. And each year, and I'll forget the term, Sue, you might help me, each year an acquittal report is provided about the research that's been undertaken, and I'm fortunate enough to have had that report shared with me. And the list of research projects that are being undertaken by people doing their masters or doctorates is just amazing. And as a layperson, I can remember probably one of the first occasions that I was at a meeting with the foundation. One of these young nurses came up to me and started talking to me about the thesis that she was putting together about how it is that you can keep an infant child still so that an MRI can be conducted to give the data necessary for the clinician to undertake the treatment that's required. Just an example of the types of things that are involved in an organisation like this.
Yeah, great, thank you. Sorry, Sarah, did you? Yeah.
I was just going to say that I've been describing or mentioned the clinical research incubator concept, and we've been having discussions with the nursing leadership and also the allied health leadership. And really, for Jim's sake, the nurses were ahead of us. And in fact, we're trying to emulate something that of what they've achieved. And I realise that you've been integral, your group has been integral in supporting them. They're leading the way in nursing research, and that to a certain extent is the model that we're trying to emulate through extending it through the hospital. So,
Thanks, Sarah. Jenny O'Neill, who was our 2021 Dame Elizabeth Mundoch Nursing Development Scholarship recipient, is on the call today, and she's really glad that you mentioned the symposium, Jim, because it gives her the opportunity to say that it's open to everyone, and we're going to be able to share a link to you all after the event as well. I think I've been on campus not as long as you, Sarah, but I've been on campus over 10 years now, and the Dame Elizabeth Mundoch Scholar, so Nursing Development Scholar, it's the largest scholarship on campus, it's a standalone scholarship, but it's been one that's been around nearly about 12 years, and it was in a way formative of nursing research, and it was kind of, when I first got here, it was kind of the only thing that kind of popped its head above the parapets and said, this is for nurses to do some to do some scholarly research, and so we've come an enormous way, and that's got an enormous amount to do with what Donald and Phyllis's legacy is all about. So we're going to share that link with everybody so that you can attend the symposium virtually on the 12th. So I think Jim's got to have a step up on that attendance, though, beyond just virtual.
Hopefully.
Yeah.
If I can get through reception.
Yeah, that's right. It's true. And just because we've talked about Dame Elizabeth scholarship, there's also a virtual. We're actually doing that scholarship lunch this coming Monday on the 10th of May. It's once again virtual, sort of things that the things that COVID has allowed us to do. We're doing a virtual fundraiser for next year's scholarship on Monday too. So if anyone wants to jump into that, Jessica would certainly be able to give you the link to attend that as well. So please do that. So we're really trying to support nursing research here on campus. Jim, I've got a question here for you, or a statement. Your passion and impact is incredible, so thank you. It's from one of our attendees.
Thank you.
The question, I guess, here was, are there opportunities to do something similar to Jim right now to support particular roles or young people at the RCH doing research? And so I guess I could potentially answer that and say we're certainly happy to get support for the clinician scientist program. As Sarah said, 32 people on that, and they're multiple, 3 to 5 years each of the years of the program. So we're very happy if people did want to support the clinician scientist role, absolutely. We're also very happy there are great other opportunities to do research. I'm going to talk a little bit about that later on, but to support research here on campus as well. I guess, Jim, I wanted to ask you one other question in particular, and that is what makes you most proud as a trustee of the fund?
That's a difficult question to answer. To be able to say that the fund has been able to assist to the tune of $2.1 million is great. I think the main thing is, if I can come back to my earlier remarks, making a contribution to the welfare and happiness of children. I know that's a terribly generic statement, but I'm about kids. I make no apologies for it, and the people that are in need of care in this organisation, my heart goes out to them. My admiration for people like Sareth knows no bounds, and the wonderful community spirit within the professional people within this organisation, and how lucky is the foundation to have you, Sue.
Oh. Thank you, Jim. That's very kind of you. Gosh. All overcome. Sareth, I'm going to thank you, Jim, again.
I'm doing the same.
Sareth, I'm going to ask you one more question, and then we'll finish up. And this is like possibly my second favourite question, because the first favourite is the how proud can you be? But my other favourite question is just to imagine for a minute that someone walked in that door to the studio and said, "We've got $1 million for something, Sareth, that will develop great impact from what you're doing." How would you use those funds? Lovely.
I've always had the utmost respect for money that's donated. By that I mean I always want to see not just that $1 million rewarded by $1 million of effective research. I want to see that multiply in terms of impact. So I would be looking to see the most effective way to get lots of impact. And for me, that's not necessarily funding specific projects, although it could be. It's about looking at individuals who have that similar respect, have great ideas that directly want to improve the patient care at the hospital, and to see that there's going to be a legacy from that. So just like we described there with Jim, that there's the $2 million, that's an amazing donation. But I'd like to say that actually the impact of that has been the equivalent to $10 or $20 million of donation, because it's left an ongoing legacy. Yeah. So $1 million is fantastically important. What a generous donation. I think luckily I don't administer the money. All I would say is that the strategy around that is, let's get $100 million of impact from that $1 million donation. Let's make sure that it has a long-term impact, and most importantly, that it's impact that directly affects patient care. That's what I'd be passionate about. So families can in this city and this state can actually benefit from that. So that's a terrible answer, because most people, I don't know if you say, well, yeah, thanks, I've got this great project I want to do. I could say that, but I don't think it's appropriate to do that. That's not how I think that the money should be invested.
No, thanks, Sareth. I think that's a terrific answer. I think that's a wonderful thing to say, because you and I both sit on our grants committee for the foundation, and I guess that's one of the things that makes me so proud, is that we thoughtfully look for great impact across all of those four pillars that I was talking about before, but particularly because we're talking about research today. But we look for what the impact is going to be. We look for how can it translate in a relatively short space of time, because that's there's plenty of other folks who can support the benchtop. But how can we get there, and then how does it leverage other work in the campus, in the precinct, and bringing more money to paediatric health and child health. So I think it's a great answer. So thank you so much.
You flapping like that as well.
We're all being lovely. So thank you everybody who's sent in the insightful questions. Thank you, Sareth and Jim, again so much for joining us today. It's been a great privilege to talk with you and to hear from both of you. Shareth shared with us some of the groundbreaking research that's taking place right here at the hospital, and I wanted to share with you a few transformational projects that the Foundation have committed to significant philanthropic funding, and they're up there on the screen right now. Excuse me. Because there are many projects that need your support, so if any of them do pique your interest, do get in touch. The RCH is joining a new frontline study looking into the treatment for children with acute lymphoblastic leukemia and lymphoma. And this is the most common of the childhood cancers and the leading cause of cancer related to death in young people. And using precision medicine and targeted treatments, the study aims to improve the cure rate as well as the quality of life for children with this type of cancer. That new study, this is hot off the presses, that new study is being conducted by St Jude Children's Research Hospital in the United States in conjunction with selected partners, and they turned to the Royal Children's Hospital Children's Cancer Centre to be one of those international partners. So we are seeking support for that right now. We're also seeking support for a campus-wide mental health strategy, research strategy. Each year, as you might imagine, the RCH treats thousands of children either at risk of poor mental health or with existing mental health conditions. The COVID-19 pandemic and subsequent restrictions have resulted in many more children presenting with mental health related issues, and the emergency department at the hospital is seeing a 35% increase in mental health presentations. So you can imagine it's really important for us to address that increase now. That's almost what you might call an acute increase. But as you understand from the Royal Commission recently, there is a great challenge out there for our whole community around a mental health strategy. So the overall aim of our strategy is to deliver high quality, comprehensive infant, child and adolescent mental health care supported by education and research to ensure the best outcomes for children and their families. So we've got a pretty terrific integrated research strategy integrated with care, and we are seeking support to be able to support the campus to work together on this really important new initiative. Another initiative requiring support is the Rare Diseases Now, or RD Now, project. Excuse me. And there's this exciting new initiative aimed to deliver genomic diagnoses and precise personalised care to sick children at the hospital. So it's drawing on the research and clinical expertise of the Mundoch Children's Research Institute and the Victorian Clinical Genetics Services. RD Now wants to explore a pathway for children who remain undiagnosed. So despite incredible process that we have around rare diseases in genetic and genomic research, there are a great number of Australian families who don't have access to genomic testing, and for whom genomic testing can make an extraordinary difference if only they can get it. So this initiative, which is part of a global alliance, is going to give patients and their families the best chance of achieving a diagnosis and then access to the latest clinical trials and treatment. This is a really important project that we've decided to jump on board with because we want to be at the leading edge of genomic and genetic research. We're funding other areas. The campus has drawn significant government funding towards the campus specifically to look at how to get genomics cheaper, more timely, and to get better diagnosis. So we want to play our part in that as well. So please, if you feel passionate about personalised medicine, you could join us in that project. And the campus is also leading the Gen V study, and this is an incredible. So it sounds Generation Victoria in the fullness of the words. We started this happening. Possibly as early as 2012, 2013, with a small gift that was left in someone's will that allowed the scoping out of what would turn into Gen V. And that now, 8-10 years later, is going to allow Gen V to see every family having a baby at a birthing hospital in Victoria offered to take a chance to participate in the study, and it's going to be families sharing information from birth about the health and development of their newborns. So for the first time ever, this is going to give us a complete picture of the health and well-being of an entire generation. Hopefully to speed up discovery and to develop solutions that will benefit all children and the adults that they will become. As I say, this is one that, early on in my time here, we put a small amount of money into, and it is just growing. And to Sareth's point before, an incredible leverage of the sort of money that can come in. We've got government money funding parts of this. We're funding part of it, and 2021 will see us, really hit the road. So you can see there are a number of initiatives that require your support, ladies and gentlemen. Through these initiatives, we're on the threshold of major breakthroughs in paediatric healthcare. But these breakthroughs, as I've said so many times today and over the years, they only happen thanks to philanthropy and to the support of people like you. We believe that investment in the future of the RCH is a gift to children and young people for generations to come. So if you have any ideas or questions about investing in the future, please do get in touch with us. A member of the team is happy to speak to you. I'm happy to speak with you at any time, so please get in touch with us. That brings us to the end of our presentation for today. We'd love your feedback, so you're going to get a short survey with a link on the screen there at the end of the session, or if you'd prefer, please contact Jessica directly. But we'd love to hear about how this has been meaningful for you and how we can also improve what we do provide for you. So we'll share her details in the chat as well. So thanks everybody for joining us again. It's been a great pleasure to share this conversation with you. I very much look forward to more of these events, either virtually or again soon in person throughout the year. One final thank you to Sareth Ranganathan and Jim Carroll for joining me today. It's been really fantastic. Thank you both for giving up your time. Our last thing that we're going to invite you to look at, ladies and gentlemen, is just a short video that's reflecting on the impact of 150 years of our great Royal Children's Hospital on our community. Thank you all again so very much, and have a wonderful day.